Forever Young BBL Hero plus Halo Laser. Follow me on all social media the exact same way you see spelled here. So this video gives the impression that a Forever Young BBL Hero treatment is very fast and within 10 minutes, and that is not the case in real life. So I sped up pieces of this video, and I also did not film every second because this would be an insanely long video, like a 2-hour video. So BBL Hero is looking, in her case, for redness. So we can target specific pigment, whether it's red or brown. And she gets red undertones that she really doesn't like and flushes very easily. She hasn't been diagnosed with rosacea, but my guess is she may have very moderate rosacea. So I recommended that she add the BBL Hero before her Halo laser. And she was willing to do this. And that's my favorite kind of patient because I know she's going to be much happier with her result. And she was and is. So anyway, I am looking for redness in the skin, and by removing that redness, it will allow the light to reflect off her skin much easier. That's why when you see really young kids, their skin looks amazing. It's because they don't have any skin damage yet, so the light reflects into their skin so much easier. So with BBL Hero, I do a base pass first, so I do the entire face, regardless if it has pigment or not, at least 2 times, 2 passes. The reason I do that is because the BBL Hero function is anti-aging regardless. So even if I'm not correcting anything as far as getting rid of broken capillaries, cherry angiomas, spider veins, any of that, it's still doing anti-aging benefits. And here you see me doing the lip area. I personally like to do the lips and the under eyes. Now, I didn't used to do this. This is fairly new for me, what I've added on. And you never stop learning with laser. So I've been using laser, Sciton laser specifically, for over 5 years now. And just recently I learned these tricks using Dr. Bitter's techniques. So after I do my base pass, my step 1, I do step 2, which is correction. I put a smaller adapter on and I go in and get the broken capillaries, the spider veins, cherry angiomas, anything like that. This is where I also will target the sunspots. So some people, I focus just on sun damage. It just really depends. But I like to do a mix of brown and red if they have it. I don't skip anything. And finally, after the corrective passes, I do what's called skin tight for number 3. So it literally helps tighten the skin, and it has been absolutely amazing. And sometimes I haven't even told patients that I'm doing that, and they will write me a message and say, I don't know what you did, but my skin looks tighter, and it's awesome. Halo hybrid fractional laser. Oh my gosh, I'm in love with this laser, and I'm about to tell you why. So real quick, the Halo starts out fairly comfortable, and it honestly reminds me quite a bit like microneedling, just because you're having to continue going over the area and working on the density rather than depth too much. Now, don't get me wrong, you still want to go a little deeper, especially on like fine lines, wrinkles, scarring. So Halo laser is the only laser in the world that has 2 lasers working together at the same time. So one laser is basically just working on the epidermis, and it's taking off that top layer, whereas the other laser is going much deeper into the skin and is putting like little microscopic holes. And that is so awesome. when you are treating acne scarring and deep wrinkles, because you have to get in there. You can't play around. So when patients complain to us about texture and saying how their skin just looks really dull and they just look tired, the deeper lasers like this are our go-to. That's going to make the biggest difference and make them really happy. So I tried to get some footage of me from the side and right above the patient directly. If you see that little green light, what I'm doing here, it's telling me that, hey, you're doing a great job. When you see the yellow pop up, it's saying, hey, you need to slow down. So I really like that. It doesn't let you mess up. It doesn't let you give a crappy treatment. It makes you do things right. And this laser is really cool. Also, if you see the tubing on the side, so there are two tubes connected to this handpiece. One is for suction, so it sucks away the dead skin cells, sucks away any smoke, because sometimes with laser you do have smoke coming off of the skin. And then it also has a Zimmer chiller, which blows extremely cold air on the skin. So the patients love that. It makes the treatment very comfortable. And a lot of times with Halo, a lot of patients are pretty comfortable during the treatment. Now there are some areas like the lip, for example, that are a lot more sensitive and it doesn't feel that good. But when you're done with the treatment, people feel like their skin is very hot and spicy. And that's because that Zimmer chiller has been removed because we're not doing the treatment anymore. So that's when patients tend to feel the most discomfort, is as soon as you're done. So a lot of times with laser before, a lot of patients would say, oh, I feel fine once you stop lasering. But it's actually the opposite with Halo. You feel more after we stop. With lasers, you cannot tan before we treat you. You don't want to tan after either. And you need a consultation before you schedule this treatment, because it's very unique and we have a lot to go over just to make sure you understand the treatment expectations. And this allows us to talk about your goals and get you the right treatment. This is what the skin looks like immediately after the treatment. And here you can see skin cells. I love it. And you have to wipe those off in between each section, because if not, skin will literally fly everywhere. And that probably sounds gross to you, but it's really exciting to someone like me. So here you can see me doing the lips. I have you put the lips in like so. And everyone tells me this is the most uncomfortable area. And it's because you just keep going over the area, and it's just a tender area. It's definitely worth pushing through though, because people tend to age in this area more than anywhere else, with the exception of the eye area. So you don't want to use anything harsh on your skin after you've had a Halo treatment. You want to be pretty basic and don't use any like vitamin A products, vitamin C, glycolic acid, anything like that that's going to irritate the skin, because we've already irritated your skin with a laser. That just wouldn't be a good idea. So we actually give you a post-care kit by Avin Skincare that you will use for at least the first week or until you are done peeling and healing. And it has very gentle products that help nourish the skin and heal it faster and take the redness out. And you can treat anywhere on the body with Halo laser or even BBL. So here you see me doing the neck. The most common areas to treat are the face, neck, and chest. Those areas people complain the most that their skin looks older. You can also treat the arm area. You can treat the back for acne scars. Literally anywhere you can treat that has skin. Hands are another thing that patients complain about. It's more common for me to do hands with the BBL function of the laser, or like a chemical peel. We have a really nice hand peel. I suspect that more people are going to start haloing though once the word gets out. This is fairly new to our practice, and I have been extremely happy with it. I love Sciton laser. It is hands down the best laser. I researched lasers for over 2 years trying to make sure there was not a better one on the market, and nothing beats Sciton. You can literally ask anyone that has several different lasers. They always choose Sciton every single time just because it does the best. It's amazing. And it's made here in America, so isn't that awesome? I hope you all enjoyed this up-close video of BBL Hero and the Halo laser, which is all fairly new with Sciton in the last few years, but very new to our practice. Like I said, we've been so happy with it. Leave a comment below if you would try this treatment, or if you have, and what was your experience. Be sure to share with a friend, because honestly everyone has been so happy with it. You can see some swelling the next day. That's completely normal. Downtime is 7 to 12 days, depending on how aggressive your treatment is. Hers was pretty aggressive, so she had a lot of redness, peeling, all that for between 5 and 7 days. So about day 7, most of her redness was gone. There was still a little bit, but not much. It wasn't as noticeable. So this was her day 6, and right about day 7, probably realistically day 8, she looked the best. 1 week later, right here, wow.